The system of care is engaging with families and youth who are potentially at risk for emotional disturbance or some mental illness. The goal of the system of care is to try and act like a glue and bring everybody together and unify the community so that we are all working together to make a better life for a child. And the goal is for us to not only surround the child, but also to surround the family unit and give them the things that they need so that they can fully engulf treatment and be better off for it.
My job as the lead family coordinator is to bring my lived experience to the family. When I meet with a family for the first time, it's basically to start building that relationship with them. A lot of families feel uncomfortable meeting with someone for the first time, but because I do have a lived experience and I do understand, I let that be known right away that I got this. I totally get what you're talking about.
The idea of the name itself, System of Care, is looking at the entire gamut from your physical health to your mental health and everything in between. This program is free for every child and or family from age 0 to 21 in the Lycoming-Clinton area.
Partnering with System of Care really creates a collaboration, and it allows us to all get together and talk about what the needs are with our families and in our community. If we have a family that is in need of transportation to medical appointments or something like that, then we have these resources locally that we can try to connect them with. That's going to be a lot of the job, is connecting the dots, bridging those gaps and trying to get the resources in place for these families to improve their outcomes.
We're community partners with literally every agency out there, and not just child serving agencies, the library, doctors, all kinds of places that we can help connect those dots for those families. And then once the dots get connected, the hope is that they feel empowered and that they can take charge, and then they can become their child's biggest advocate.
We have a slogan that is called "Nothing for us without us." That is identifying that I have a voice in what you're telling me to do. It's not about you telling me to do something and I have to go without any say, but I have a role. And if I have a role and a part to play in my treatment, I am better suited to be able to follow through with that. And it's better suited to stick with me because I was a part of that instead of somebody telling me what to do. And we all know children, you tell them something, then they'll do the opposite. But if they have a part in the decision-making process, then it's more likely that they'll follow through with it.
It is extremely important to have system of care in both Clinton and Lycoming County for a number of reasons. One of the biggest reasons is it's something new that nobody has. Neither county has anything like this. There's all kinds of programs in each county, but there's none that are connecting everybody together. So a family can get started with system of care in a number of ways. One of the biggest ways is self-referral. Getting the word out has been one of our biggest goals, just communicating with people. So they can get on the website, and there's a referral form right there. There's also phone numbers for all of us on there. They can connect through their pediatrician. They can connect through their service provider.
We want to make sure that we're meeting the needs of our community, not only our partners in the professional realm, but with our families and youth as well.
People need people. The world's really tough right now for kids and adults. And I really am a believer of if we work together and support each other, our kids will do better.
Just imagine a day when every child, no matter where you are, what you look like, what you smell like, what background you are, what side of the tracks you come on, is seen and heard and valued because of who you are instead of your circumstances. That is the system of care in a nutshell.